My name's Dr. Lily Brown, and I'm the director of the Center for the Treatment and Study of Anxiety at the University of Pennsylvania. June is PTSD Awareness Month, and in honor of this designation, the CTSA is releasing a series of educational videos about PTSD, including information about how to treat PTSD and the consequences of PTSD. During this first video, I'll be defining post-traumatic stress disorder. In order to meet criteria for PTSD, an individual first has to be exposed to a traumatic event. Traumatic events can include actual or threatened physical injury or sexual violation, or witnessing physical injury or sexual violation occur to someone else. Traumas can also occur in the context of an occupation, such as frontline clinicians working throughout the COVID crisis. We know that the majority of individuals living in the United States will be exposed to a traumatic event at some point in their life. Fortunately, though, many people who are exposed to a trauma do not go on to develop full-blown PTSD. In order to meet criteria for PTSD, individuals have to report symptoms in 4 key symptom clusters. The first symptom cluster is avoidance. Individuals with PTSD sometimes avoid external reminders of the trauma, so this can include people, places, or situations. And they can also avoid internal experiences, like thoughts, memories, or even emotions. The second symptom cluster is alterations in arousal and reactivity. By this we mean individuals experiencing heightened levels of physiological responses or awareness of their environment, or in some cases, the opposite in an extreme way. Symptoms like numbing out or even dissociating from real-world experiences. The third symptom cluster is called intrusions, and these include unwanted, distressing memories about the trauma or nightmares about the trauma. Essentially, this includes thinking about the trauma when people really are trying not to. The final symptom cluster is changes in cognitions or in mood. It's very common for people who've been exposed to a traumatic event to notice changes in the way that they see themselves, other people, or the world. It's also common for people who've been exposed to a trauma to report symptoms that resemble depression, things like not being interested in things that they used to enjoy. So to recap, in order to meet criteria for PTSD, a person must have been exposed in some way to a traumatic event, and also to report a number of symptoms across these 4 symptom clusters. If you or someone you know is suffering with symptoms of PTSD, please reach out to the Center for the Treatment and Study of Anxiety at this website. We have a number of resources available to help provide treatment to individuals, and we also have a comprehensive list of referrals to providers throughout the country. If you have any questions or feedback, please feel free to email me at this email address. And thank you very much for listening.